I'm really glad to be able to welcome you to the second to last session of the day. And because I'm not biased at all, I will also say that this is going to be the best session of the 3 days. The session is from vulnerability to resilience in risk governance. We have 4 speakers who are all based here at the university with us in person and will be presenting. I would like to introduce our 4 speakers to Holly, who will be the timekeeper. Holly is far more scary than I am as a timekeeper. So I urge you to please just kind of keep an eye on the signs that she's putting up and give her a bit of a nod, just to acknowledge that you know that you're probably going to be going over time. So without further ado, I will introduce our first speaker, who you can probably see by the slide in front of me already, is Priti. And Priti told me that one of the biggest issues that we have around legislation is that we talk about it being inclusive, but it's going to be very, very hard for us to find any legislation that actually takes into account persons with disabilities. So please welcome Priti.
Thank you. Is it okay? I'm audible? Yeah, okay. Thank you. Good afternoon, all my dear brothers and sisters. I'm Priti Pohekar from Swatantraveer Savarkar Mahavidyalaya, Beed, Maharashtra, India. And this one? Yeah, this one. Thank you. Okay, so the title of my paper is Empowering Vulnerability, Inclusive Practices in Disaster Risk Reduction and Management for Physically and Mentally Challenged Persons. So friends, I aim at analyzing the journey from vulnerability to resilience in India's risk governance, focusing on the inclusion of PWDs in disaster risk reduction efforts to empower these vulnerable groups and ensure their active participation in resilience building efforts. To start and understand, I have given the definitions of vulnerability, resilience, empowerment, and of course, disability. I just talk on disability, that is a significant hurdle in moving, living, and surviving of a person. It is a range of physical and mental conditions that affect a person's movements, senses, and activities. In India, according to the Person with Disabilities Act 2016, there are 21 types of disability categorized under 5 different titles: physical disability, intellectual disability, mental behavior disability caused due to different, chronic neurological conditions, multiple sclerosis, Parkinson's, blood disorder, just like hemophilia, thalassemia, sickle cell disease, etc. And 5th one is the multiple disabilities. The World Report on Disabilities estimates that 15% of the global population experiences disabling conditions. In India, in 2011, out of the 121 crore population, 2.68 crore persons were disabled, which is 2.21% of the total population. To know about resilience of the laws, let's have a look on the frameworks and mechanism adopted for inclusion and empowerment of disabled persons. The UN Convention on the Rights of Persons with Disabilities 2008 is the first international human rights treaty specifically that was addressing the rights and freedom of the persons with disability. The survey conducted by the UNISDR in 2013 on living disabilities and disasters, it was the first ever global survey of persons living with disabilities focused on how they cope with disasters. Of course, Sendai framework for disaster risk reduction, all we are aware, it calls for inclusive and accessible disaster risk reduction, recognizing the need to integrate the perspectives of people with disabilities. Sustainable Development Goals, in fact, it mentions disability for 11 times, and disabled persons or vulnerable persons for 6 times. However, the document is not sufficient for the full inclusion of disabled persons in disaster management. The Disaster Management Authority in India has developed some guidelines to integrate disability concerns into disaster management plans. These guidelines emphasize the need for accessible infrastructure, communication, uh, emergency services, etc. But friends, all these documents are best. While the documents reflect DRR goals, the field implementation remains questionable. Yesterday, the mayor, ma'am, correctly said that the lessons are not learned until embedded to learn. For the purpose of my paper, I have surveyed 30 persons, 5 visual impairment, 2 hearing impairment, 3 speech and language disability, orthopedic surgeons, 5 social activities, those are working in the field of disability, 3 persons, 8 tutors, physiotherapists 2 and speech therapists 2, totally 30 persons for my studies I have surveyed. And while talking about disability inclusive risk governance, it is necessary to know the challenges behind the task. Very first challenge is there is insufficient, I am talking about India, of course, there is insufficient disaggregated data on disabilities that hinders effective planning and response. Emergency shelters, communication systems, and evacuation routes often remain inaccessible to disabled persons. Disabled persons are frequently excluded from decision-making processes related to disaster risk governance. Societal attitudes towards disabled persons, particularly in developing contexts, often translate into discrimination, stigmatization, and limited opportunities. Despite global efforts to promote inclusion, challenges persist in areas like education, employment, housing, and social acceptance. Now, overcoming these challenges, it requires coordinated efforts at multiple levels. So it is also important to know why disabled persons need special attendance in rescue operation or pre or post disaster management. PWDs are often marginalized physically, socially, and economically. They are frequently left behind or abandoned during evacuation in disasters and conflicts. Persons with disability face unique challenges at every stage of emergency and disaster management due to inaccessible warnings, evacuation processes, response efforts, um, including shelters, camps, food distribution, etc., and long-term recovery inclusion in humanitarian and DRR intervention. Tutors and social media could play, in fact, significant role in altering them, earning their trust. So, in my survey, I got that 36.3 respondents believe they can access equal resources and aids in shelters or relief centers. Additionally, 90% expressed a desire to participate in local disaster management and risk reduction planning processes. All respondents have the same opinion that their inclusion is kept behind at local level as well as national level. They also suggested that they should offer teaching, theory, and practice of disaster management. So inclusion of physically and mentally challenged individuals in risk governance is a broad concept essential for protecting the most at-risk community. In India, we call Divyang for disability. The word is coined by our Prime Minister Narendra Modi. A word is more inclusive and respectful towards individuals with disabilities. The usage of word is intended to convey the idea that people with disability possess unique abilities and strengths rather than focusing solely on their limitations. So here are some suggestions or recommendations to include PWDs in risk governance and empower for Build Back Better. My suggestions are based on the study I made, but it will reflect the scenario of, I guess, Asian countries also. Integrating disability considerations into national and local DRR policies, laws, and frameworks is a dire need. This includes budget allocations for accessibility measures and support services. Okay, so I'll go fast. You can read all my suggestions, and um, of course, finally, I will say that a partnership between common citizens, government agencies, NGOs, and disabled persons organization is very necessary. After all, no efforts will be successful if failed in implementation, of course. And to conclude, the transition from vulnerability to resilience in India's risk governance, particularly for PWDs, is an ongoing process that requires sustained commitment and innovation. By embracing inclusive, particularly participatory and integrative approaches, India can ensure the PWDs are not only protected in disaster scenario, but also empowered to contribute to resilience building effects. With this, I stop here. Thank you.
Thank you so much, Priti. We often talk about the problems that we face, so it's really refreshing to also see a slide that is entirely full of recommendations for things that we can then do, that talk about a way forward as opposed to a way that we can kind of get stuck in seeing what's so wrong. So thank you for that. But also thank you for reminding us that the end goal isn't to just write down really good policy, right? The end goal is also to ensure that at an operational level, we're making sure that the policy is working for people, as opposed to working for the great big photo shoots that we have when we sign these documents. So I also now have the pleasure to introduce our second speaker, Marlon Era, who is from a place that I once upon a time used to call home. And he will be presenting on the roles of elderly population during disaster in the southern city, Philippines. Is it a burden or a benefit? We'll find out in 10 minutes, apparently.
Once again, good afternoon, everyone. Thank you. I'm returning as a presenter. I think one of the challenging question to ask is, how old are you? I think that's a not very comfortable question to ask. Okay? Do you agree? I'm not going to ask, how old are you? Anyway, the motivation behind pursuing a study, because the Philippines, as you may know, I'm happy that I'm one of the Southeast Asian nations represented in this very important conference. So my motivation is to look into the role of elderly population in disaster preparedness and response in a city. Okay, all right. So I intend to give my presentation in the interest of time this way. I'll give a brief introduction. What are the related studies on this? This is an initial study. What was the methodology? What the local of the study, and then results and findings, and then conclusion. So there's a national law in the Philippines, Republic Act 10121, Disaster Risk Reduction and Management Act of 2010, which defines vulnerable and marginalized groups. And if may I, those includes, but not limited to women, especially pregnant women, youth, children, especially orphans, and accompanied children, elderly, differentiate, etc. So in a nutshell, elderly are considered by default as vulnerable group. So the characteristics of being vulnerable is determined by physical, social, economic, and environmental factors or processes which increase the susceptibility of a person, a community, or a system to the impacts of hazards. Vulnerable groups are those that face higher exposure to disaster risk and poverty, including but not limited to women, children, elderly, and then of course differently abled people, I think PWD and ethnic minorities. So some of the stereotype about elderly population are considered to have its negative stereotyping of their dependency and burden, because when you're getting older, you need more health and medical requirements, then you become a liability or something like that. Elderly people are least prepared for disasters. At least these are some of the common understandings that I gathered. They have the highest rate of disaster-related deaths. The number of disasters is on the rise and becoming more destructive. And therefore, there's a need to take that into serious consideration. Older adults become more at risk in all phases of hazards, from rescue and evacuation until the psychological consequences during the recovery period. But not all elderly are equally vulnerable to disasters. And therefore, this study aims to determine the roles of elderly, specifically those living in their own homes, because I understand in many developed countries, elderly are living in a different setting. So in the Philippines, I think this is part of the culture and practice that even older elderly are at least staying with the home or with the community where most of the family members are there. So this is specifically in the southern part of the Philippines. So if you're familiar with the Philippines is divided into 3 major islands. We have the Luzon, Visayas, and Mindanao. So this is more or less based in Visayas. Okay. So what are some of the research-related studies? Research on preparedness are focused on authorities preparing for responding to an event rather than an individual. For example, developing social vulnerability, which includes communities to assist emergency response workers when dealing with an event. In aged care facilities, because they considered aged care facilities as a priority because of the nature of the people living in that, carried out on guidance in preparing the facility for emergency events, such as the need to evacuate, when there is a best time and what is the best time, okay? The paper will focus on their own homes, as I mentioned. Most disaster DRR management research concerning older people focuses on the recovery phases. I think recovery, at least in the Philippine context, this is the phase of disaster which not much people or even the government pays so much attention because there's nothing more to address, seemingly. That disaster is gone and recovery is there. Not much funding, not much efforts. Dominant among studies on older adults are focused on reconstruction and recovery phase. So there's a dearth of literature with regards to older people on disaster preparedness and response, hence the focus of the study. This was a survey conducted in barangays in the Philippines and a focus group discussion of members of barangay and elderly. What is a barangay in the Philippines? Barangay is the lowest political unit in the Philippines. It's like a village, a community, but the leaders are elected by people. A city or municipality or town is composed of different barangays. So punong barangays or the head of the barangay is a very powerful elected official because he or she heads the executive, the legislative, and the judiciary all in one. So take one, buy one, take one, something like that. This is the map of the Philippines. I think for those who will be going in Manila conference, this is the locale of the study. I think I'm not going to dwell more on this, but let me proceed. So what are some of the prior exposure to disasters of the city where the study was conducted, which, you know, exposes the older people? Typhoon Undang, this is Tropical Storm Agnes in 1984. These are the things that they remember. Typhoon Senyang, Utor 2006, Frank, okay, and the worst earthquake in 1948. Okay, barangays have early warning systems but limited to transportation vehicles and evacuation centers. What were some of their experiences? Well, some of them were not permitted by their children to volunteer to disaster preparedness and response activities. Okay, so they said you are not capable. Okay. Elderly have but some elderly have strong desire to serve volunteers during disaster preparedness. So there's a mix of responses. These are the regular assistance being received by elderly in the Philippines, more or less about $20. And then some seniors are unaware of the local government programs on DRR. Now, surprisingly, not surprisingly, but I was able to discover that the elderly in that city able to do a lot of things during preparedness and response, such as repacking of relief goods, assist in the community kitchen and food preparation, provide psychosocial intervention, language interpretation, assist in the identification of missing persons, assist in providing first aid to injured victims, and take care of young children. So I think there could be more, but these are the things that surfaced during the focus group discussion. So these are some of the things that I just to make it more vivid for you. So elder members of the city have gained the respect of other community members. This makes them possible source of knowledge in their communities. Prior exposure to disasters help older people establish a systematic know-how, right? Because experience is the best teacher. Elderly in the study area are more vigilant that enable them to provide support as carers in their communities. The elderly will be able to provide inspiration that can give guidance on how to go about disaster preparedness and response. Participants of older community members in disaster preparedness has contributed to increased confidence, particularly older women. They have demonstrated their ability to plan, lead appropriate responses to disasters using the skills acquired. These activities benefit both vulnerable older people and their communities. In conclusion, elder populations by default are not victims of disaster. They can be served as volunteers to assist in varied tasks, as mentioned earlier. The roles of elderly populations during disaster preparedness and response are beneficial to the community. A number of elderly able to participate in different tasks and responsibilities. The elderly's experiences and familiarity with the community enable them to identify the needs and vulnerabilities of their families and neighbors, including the most vulnerable older people. There is a need to revisit the definition of vulnerable groups as defined in the national policy. Elderly considered as expert of their own lives and therefore could be more of a benefit rather than burden in the city of Iloilo. Let me end with a quotation. Aging is not lost youth, but a new stage of opportunity and strength. With that, maraming salamat po.
Thanks so much, Marlon. For anybody who's trying to figure out how to cheat the system with the timekeeper, this is an excellent example. You have 3 slides that say in conclusion, but you keep reminding Holly that you're about to finish. But critically, it was a really, really important reminder. I think it kind of ties into something that Smriti from one of the earlier panels mentioned around the value of social capital and the strength that brings into building resilience in response efforts. And I will plug some really good research that came out of USB fairly recently that kind of compared the responses to Hurricane Katrina with the responses to the tsunami in Samoa, as well as Cyclone Winston in Fiji. And the key difference between those 2 things was the kind of the role that society played in rebuilding resilience in those instances. I now get to welcome somebody from Fiji to present. So the 3rd speaker on the panel is Meenal. She has several other members who are part of her research team, but we are very lucky that we get Meenal here to present for us. And Meenal is looking at advancing inclusive disaster risk reduction efforts among people with special healthcare needs in Fiji. So over to you, Meenal.
Good afternoon, everyone. Since Ernest has already introduced me, I'm Meenal from Fiji. but I'm currently a PhD candidate at the Griffith University in Queensland, Australia. So the topic that I'm going to speak to you about is advancing inclusive disaster risk reduction among people with special healthcare needs in Fiji. This is a project that I'll be working on, so I'll just briefly go through what I intend to work on. So introduction. So we know that there is an increased recognition for DRR activities in addressing vulnerable communities' exposure during disasters. So primary healthcare tends to emerge out as one of those fundamental components in the DRR efforts, emphasizing its importance, particularly having a look at person-centered healthcare services and community-based, making it more accessible for people. On the other hand, people with special healthcare needs who face a wide range of physical, cognitive, sensory impairments, including who tend to require special healthcare approaches in accessing health services and also in taking into account their health needs during, before, and even after disasters. Fiji Islands, located in a disaster-prone region, having a lot of natural hazards and the vulnerability, particularly of this island, a small island developing state related to climate-related disaster, it complicates the health needs and actions to advance inclusive DRR for this particular population, which is people with special healthcare needs, which is not basically known in Fiji. So while undertaking this study, I had a look at some major contextual fields that I look at, which are disaster risk reduction, the first one. The second one I look at is primary healthcare services. Third is people with special healthcare needs, with a particular focus on individuals with chronic health illnesses. And then the setting, which would be in Fiji Islands. So according to what we know at the moment, after undertaking study of the 4 fields, is that disaster risk and natural hazards contribute significantly to global health problems. And there's a robust and well-coordinated primary healthcare service, which enhances preparedness and response. Based on people with special healthcare needs, they are inadequately included in preparedness plan, disaster preparedness plan. Also highly vulnerable to natural hazards, affect public health in Fiji, which increases incidences of injury and disease outbreaks. What we don't seem to know at the moment is that the specific vulnerable groups and their inclusion. We know there are vulnerable groups, but which specific ones and whether they are included or not. Healthcare support for these vulnerable groups in remote areas during disasters. The specific health needs of this population as well in disaster context, how they are accessing services, and limited data on how health needs of specific populations are captured in local DRR preparedness plan. So DRR in Fiji, what we are familiar with, the economic losses due to natural disasters, causing around 1.4 million damages, which was equivalent to 31% of Fiji's gross domestic product. 45% of the population currently are living in flood-prone areas, cyclone-prone areas, which underscores an importance of effective DRR measures. And the DRR in Fiji is governed by the Disaster Management Office under Ministry of Health and Maritime Development and Disaster Management, which is guided by the other policies as well, which is the National Disaster Management Policy. So the NDRR Fiji policy, which aligns with the Sendai framework. So we've discussed a lot regarding Sendai framework since yesterday. So our NDRR policy does align with the principles that are in the Sendai framework as well. When looking at primary healthcare in Fiji, so yes, we have around 1,200 doctors and 2,500 nurses serving the primary healthcare setting, which is in the public health region in Fiji. 90% of the population do have access to essential services, which reflects the continuous commitment Fiji tries to provide in terms of providing primary healthcare services to its people. So the primary healthcare is governed by Ministry of Health and Medical Services, which implements the National Strategic Plan for Health in Fiji. And the governance framework for primary healthcare prioritizes the community-based health services, disease prevention, health promotion, which aligns with the global health initiatives that we have. So when it comes to looking at the population, people with special healthcare needs in Fiji, 13% of Fiji's population have some form of disability, including people with special healthcare needs. So, and also to note over here is that there are other studies being conducted on people with disability in Fiji. DFET is doing a couple of studies as well, trying to understand their needs of these disability people. 60% of healthcare services are affected, areas reported due to severe disruptions in services, which impacts the continuity of care for individuals with chronic health illnesses in Fiji. NCD, which everyone knows, tends to be a boomer in Fiji, particularly diabetes, cardiovascular diseases, which affects 30% of our current population, which tend to need appropriate medical care and support. So individuals with chronic illnesses suffer disproportionately during disaster emergencies due to disruption in primary healthcare access, particularly accessing medication, support system, which underscores the need for tailored strategies, tailored inclusive DRR strategies. So when it comes to having a look at inclusive DRR in Fiji, we do understand there has been notable efforts been undertaken to develop inclusive DRR strategies, but still, there are some significant gaps which tend to remain, particularly when looking at the needs for people with special healthcare needs. Mortality rates among this population has increased by 15% due to lack of access to primary healthcare services during disasters. Insufficient resource and funding, which tends to be a major factor in small island developing states, and I guess it continues to be there. In order to support inclusive DRR initiatives, which limit the effectiveness. Healthcare services are not resilient to disasters, leading to service disruptions that disproportionately affect individuals with chronic illnesses. So knowing the fact that so much has been done in Fiji, access to priority health needs still tend to remain as a challenge for people with special healthcare needs, particularly individuals with chronic illnesses in remote and rural regions in Fiji. So the study that I'm intending to do, we have been deriving it from this particular concept whereby climate-related disaster events, which tend to affect Fiji Island, affecting the vulnerable population, which are people with special healthcare needs, and looking at the two global frameworks that we study, which is the Sendai Framework for Disaster Risk Reduction, focusing on risk reduction, disaster risk reduction, which will lead to enhancing preparedness for effective response in Fiji. And the second global framework that we look at is the WHO, how the WHO Health Emergency Disaster Risk Management Framework works in understanding primary healthcare services, particularly preparedness, primary healthcare preparedness. So when we try and look at how we can integrate health into disaster risk reduction, we come to have a more clear understanding on what the health needs to be for people with special healthcare needs during disasters, leading to a community-based inclusive DRR. So the shaded portion tends to be actually the portion of my study, which I would be actually working on, which will lead to having a clear understanding of dealing with people with special healthcare needs, leading to the aim that I will have for my project, which will be investigating the priority health needs and actions to advance iDRR for people with special healthcare needs in Fiji. So I won't really go into the details of the method, but just to have a brief overview, it would be a sequential explanatory mixed method study, combining quantity and quality methods. Community needs assessment will be undertaken in the western region of the country. It is going to be a 3-phase study underpinned by grounded theory. So the first phase will be looking at a critical literature review phase. Then second phase commences with the fieldwork, with the third phase. So there will be further involvement of primary and secondary data, document reviews, observations, in-depth interviews, focus group discussions. So that's a 3-phase study that will be there. And overall framework of how the study will be undertaken. So the significance of the study, the findings of the study will look at addressing the major critical gap, which is focusing on iDRR amongst people with special healthcare needs in Fiji, particularly on the health of individuals with chronic illnesses. The results that we will derive from the community needs assessment is going to inform us on designing of interventions that will be specifically tailored for to the health needs of people with special healthcare needs. Furthermore, the insights that we will gain from this study is going to serve as a foundational resource for future recommendations for protocols, training programs, and resource allocation strategies, which will lead to strengthening primary healthcare preparedness for people with special healthcare needs. Furthermore, it will provide recommended strategies addressing the priority health needs of this target group, contributing to advancements in greater inclusive and resilient healthcare system. And finally, this study is going to provide a roadmap, a map of needs and recommendations for future development of a community-based primary healthcare disaster preparedness framework that will action the health needs of individuals with chronic illnesses locally, as well as in the other small island developing states. So that's all from my end. Thank you very much.
Thank you so much, Meenal. So we've come towards the end of our panel, and this is about almost the time when you get to ask as many questions as you like. And there is lots of time, so don't worry, you can ask as many questions as you like to the panel that cannot really move anywhere from you. So, Meenal, you made a really excellent point around how disasters are but a layer that's added upon reality, right? They don't replace and overwrite what reality is. So if primary healthcare is something that is stretched in kind of peacetime, then that reality is going to be only worsened in the wake of a disaster. And so we can't just pretend that we start from zero again when we're planning for disaster phases. I don't really know how to use a computer, so I'm going to allow Padmini to kind of focus on getting her slides to be shared. I'm told that I'm not allowed to introduce Padmini as the oldest member of the disaster law team. So I will just say she's the longest serving member of the disaster law team. But Padmini will kind of shed some light on the work that the disaster law team does, as well as the tools that we kind of suggest and recommend on protection and inclusion of marginalized groups. Padmini is the disaster law advisor for Asia Pacific. And if you're me, is the person that I go to when I can't find anything. Because Padmini has a way of being able to kind of make anything appear. So if you need something, Padmini is the person to go to. Also, if you want to be particularly unkind to Padmini, which I don't recommend, you can have a look at our disaster law website for ideas and questions you can ask her while she's presenting.
Thank you, Ernest. So just to clarify, longest, not old. So by now you would have heard a number of times people mentioning the IFRC disaster law team. So for those of you who are not familiar with what we do, the IFRC disaster law program works with national Red Cross and Red Crescent societies and their governments to strengthen disaster risk governance through the development and implementation of disaster and emergency related legislation, policies, and plans. So how do we work? I just got asked this during the break as well. There are three main ways that we work. We provide technical assistance and advice to governments that are reviewing their domestic disaster laws and policies. We conduct and publish research and guidance on best practice for domestic disaster law, and we conduct capacity building on disaster law. So laws, policies, and plans underpin all aspects of disaster risk management. Despite significant improvements in recent decades, many countries still need to strengthen their disaster laws to effectively manage the risks and impacts of disasters. It is against this backdrop that through over 20 years of research and practice around the world, the IFRC disaster law team has developed extensive guidance on how domestic laws, policies, and plans can best support disaster risk management. This body of recommendations has recently been consolidated into a single guidance document, the Disaster Risk Governance Guidelines, Strengthening Laws, Policies, and Plans for Comprehensive Disaster Risk Management, the document that you see behind me. So henceforth, I'll be referring to it as the guidelines because the name's really long. So the guidelines are a tool to support the lawmakers and government officials at all levels who are responsible for the development and implementation of disaster risk management. So as you can see, the guidelines address all key topics that need to be addressed in domestic disaster instruments, from reducing risk through strong building codes to declaring a state of emergency to being ready for recovery. So these are the 10 topics that are covered in the guidelines. So the guidelines are designed to assist law and policymakers by serving as a benchmark for assessing domestic instruments and identifying strengths, weaknesses, and gaps. So it is of key importance that legislation should provide the necessary protection and participation of all marginalized groups and ensure their rights and needs are addressed. So since it is especially relevant to this session, I'd like to highlight a few examples of guiding questions that were taken from our IFRC disaster preparedness and response checklist that can be used for the review of a legislation. There are a whole lot more guiding questions that are available in the checklist, which is on our website. So here is a list of recommendations for general measures on the protection and inclusion of marginalized groups that law and policymakers should take into consideration. For example, ensuring the representation of marginalized groups in key disaster risk management bodies, and consultation in the design and implementation of disaster risk management activities. Here are more recommendations for contingency planning. So I'm not in the interest of time, I'm not going to go through all of them in detail. I'm just looking at Holly to make sure of the time. Research shows that mental health, so MHPSS is mental health and psychosocial support. So it shows that MHPSS is a key gap in disaster laws, policies, and plans. Here are a few recommendations that are in the guidelines related to mental health and psychosocial support. There are a lot more recommendations in the guidelines on the other areas. And all this is available. So for more information, you can visit our disaster law website, where it has resources, including there's regional, sub-regional, and country profiles, and from across the world, and tools and research materials developed by the IFRC disaster law, as well as the disaster law online training. So the website is also home to, and I think this might interest a lot of y'all, it's home to the world's largest collection of materials on disaster law, so the disaster law database. And if you have any questions or you would require more information, you can contact us via our email addresses. Thank you.
Thank you so much, Padmini. Could we have another round of applause for the 4 speakers, please? Padmini mentioned something really important when she highlighted some of the guidance that's available. And if you kind of had the chance to read through some of it, you would have seen that they're actually very, very simple suggestions. They aren't anything that's going to be overly complicated for anybody to be able to implement. And it kind of points to something that I think Marufa might have been mentioning earlier, right? Like you can't overly prescribe or overly mandate things because it's going to reach a point where it's just impossible to implement. And then that becomes a stumbling block. So it's really kind of mastering this balance between trying to regulate without over-regulating and tripping our own selves up. But thank you very much to our 4 panelists. I think we actually were in the 40-minute mark, which if my maths is correct, which it normally isn't, is 4 times 10 minutes should be fine. But we are now opening up to questions from the room. I believe we have until 3:30, is that correct? So please, open for questions. I think I'm supposed to pass it along. Oh, yes, question from the back.
Yeah, thank you very much for your presentation. I think I enjoy it very much. To be honest, I'm a big supporter of inclusive risk governance. But over the last 5 years, I noticed the danger of the false promise of this collaborative governance, especially when in the context where IFRC is involved, developing tools like this. I think it's beautiful, but there is a risk of this peaceful kind of arrangement with the government that risking excluding critical voices from young democratic countries in Asia Pacific, for example, because I've seen the declining democratic phenomena in Asia. I come from Indonesia. I got involved in some funding project design. I was surprised to see in the name of collaborative governance, we tend to avoid the critical civil society actors because they are somehow they are categorized as risk factor because the government will kind of threaten the funding and international partners not to sign any MOU or continue follow-up MOU. Initially, I thought the risk is not that big, but if you look at what happened in Indonesia, in India, where there is a rise of militarism and declining democratic space, I think there is a need to rethink about the other vulnerable civil society groups. I think it's very convenient if you take the marginalized groups like disabled groups, LGBT, and aging. They're peaceful, they're silent, governments are happy for you to bring them in. But when you include the other side, who is actually vulnerable, being activists, there is no better job for them. Keep barking at the governments about many governance issues. I think they are vulnerable, but they are kind of barking. So it puts international partners like IFRC and colleagues from the UN in difficult position and bilateral governments, donors in difficult position. But if you don't engage with critical civil society, who is actually going to guard the governance? Because governance is about accountability, checking, and so on. In many post-disaster settings, it's the critical NGOs who criticize the government about corruption. It's not the peaceful actors like international colleagues who is avoiding conflict with the government directly. I'm not suggesting you to go directly face-to-face with the government for disagreement or something. It's not like that, but I think there is a way, there needs to be a way to be fully inclusive. So not selectively inclusive those who are silent. It's very easy to do that. I mean, it's not easy over the last year, of course, but I tend to suggest that there is a need to rethink. Because what happens in Indonesia is when the National Disaster Management Office is going to be revoked because of the political pressure, there's no one there to support them, apart from the critical civil society. So there's a big danger of avoiding critical partners in the conversation. You might not like it because they are kind of talk too much probably, but without them, it's pretty hard to sustain what you are trying to protect in the first place. Thank you.
Thank you. And I think it's a really interesting comment, right, around ensuring that when we talk about inclusiveness, we're talking about genuine inclusiveness. And sometimes that means involving people that we definitely don't agree with. And it's not always about how do we have a fight, but how do we have a conversation, recognizing that there is an end goal, which is serving people. And it's not an easy conversation. And I note that you described international actors as being the peaceful ones but sometimes it's usually a state of necessity as opposed to a state of desire, right? We exist often at the behest of government's allowance. So there is a line that needs to be tread. But I fully appreciate your point, and I will throw to the panel to see if anybody has a comment that they would like to make or an example from their own experiences that they would like to draw on?
Hello. Hello. So I may not be the older in the group, yeah. But I think I consider I consider the advocacy for elderly as you know, age is a spectrum. Okay. For example, I think in many countries in the world, you become a senior citizen when you reach the age of 65. In the Philippines, it's 60. When you reach the age of 60, you're already considered a senior citizen. Okay? So in a way, countries vary in terms of their policy, their definition, their context. And therefore, because I understand the law, assumes that everything are the same. Okay? And therefore, I agree there's a need for genuine concern for identifying who are marginalized. No? I think the point that I'm driving at in what I'm trying to, in my study is do not make it a default that when you're elderly, you cannot be useful anymore during disaster response and preparedness. So I think that's something to look into, and I think it will be beneficial because a significant number of people are old, no? And I think everyone will get old. Is there anyone here who's not going to get old? Thank you.
I want to add one thing. You correctly said that democracy is declining fastly. But always question in front my is, where is democracy? If any person of the society is not included in the in the democracy, so how we will say that it is democracy? I mean, when we talk about equality or inclusion, you rightly said that inclusion is never selective. It is absolute inclusion we expect. Talking about disabilities, no disability is included in any act, any policy, in any plan regarding disaster management or DRR. So I may say that it is not inclusive. Our act or policy or strategy is not absolute inclusive. Thank you.
Thank you very much for your feedback. Yes, I do agree. When it comes to discussing in terms of inclusiveness, we can say there's lots of policies around relating how to achieve inclusiveness. But the term inclusiveness, when we critically think about it, how do we achieve that? And for that, we just can't just continue writing policies and then enacting it, implementing it. Okay, let's see if it's going to be followed. We won't be able to achieve that unless and until we go down to a community level and find out what the actual problem is. Once we get to know what the actual needs are for these people, then it's better to actually walk up and then derive ways to include all these people in one. It's not easy to achieve inclusiveness overnight. It takes a long time, and it has a continuous effort involving communities. There are people out in communities who may not accept what we are trying to put across. They may have their own views, and we have to take into account those views as well. So it's all about understanding each other and working from community level up. Thank you.
And I think Ernest covered it well as well, because you know, the word inclusive in itself is like self-explanatory. You should include everyone. We don't get to pick and choose who should be included. Yeah, but I think my panel speakers have covered pretty much everything. But thank you for your point.
Thank you. I see Exley has a comment. Oh, and then we can kind of whittle our way down just so it's easy for our mic passes.
Thank you very much. I'm a very strong advocate for inclusivity. And it's great to hear examples from India and Philippines today, along with the study that's going to be undertaken in Fiji. In the context of Pacific Island countries, there's no shortage of policies and plans. Sometimes some of our countries think they are overly assessed. There's so many policies that covers different things. I think what's equally important is looking towards the implementation of policies. That's also something that's equally important, apart from finding entry points to elevate some of these critical issues to policy making at the country level. And in that context, one particular grouping that is missing in this room today is those that are in ministries of finance and planning, development planning. And I think going forward, if we have these kinds of engagements in the future, it might be an opportune time to invite some people in ministries of planning and finance, because the main message is risk informing development. And if we have this inclusive approach and risk informing development, everyone owns the narrative going forward. So that would be one observation from my side as we move forward. The second, that guideline that IFRC has developed is a very useful initiative. And just coming from a financing perspective, one key challenge that I touched on yesterday is we have so many plans and policies. Most of them don't have an implementation plan that's costed. And that's a real issue. I mean, with my many years of experience in the climate finance space, whenever our countries go out to engage with partners and engage with the funding mechanisms, they would come back and ask how much you actually need, and they don't have that answer to give to partners when they engage. And if a guideline that would also integrate that kind of advice, that it's important that you develop policies, but also have your implementation plan that is costed or indicative costing, because that allows you to engage more meaningfully with your partners. So that's just something that I wanted to draw in addition to that first comment. Thank you.
Thanks so much, Exley. And I think that's an excellent point, right? Like, if we are able to front load a lot of the work around what actually happens after we've developed the gold standard policy, that enables us to be in a better position to control or manage the conversation that we have when it comes time to actually implementing. Because what we don't want to be is like the branches of the tree that just get blown around, because this is where the money is coming from. This is where the power is lying. Exley, as you can probably tell, has a significant amount of experience with kind of dealing with this sort of thing. So he's, I know I saw some hands raised around here. Oh, there's one at the back.
Kia ora, my research is in community engagement and disasters, but I'm also a disaster response volunteer. So Marlon, what you were saying with the elderly, I saw firsthand, a lot of our volunteers are elderly. So COVID-19 was a really good example of, we're losing a lot of those volunteer populations in health and pandemic, things like that. So my question is more around self-efficacy and hope, because it's been shown that self-efficacy and hope increases resilience for communities. So specifically, this is a question for all. This is a question I don't think New Zealand does well either. How can we increase self-efficacy and hope in those populations, especially preparing for disaster, and especially like in a health issue where we lose a lot of our volunteer capacity?
Thank you.
We have to go for the practices for absolute inclusion. For example, in the rescue camps or shelters, the instructions must be given in the sign language or in the Braille language, Braille Lipi. The volunteers in the rescue camp or shelters must be trained to how to treat to the person with disability. For example, few persons are caught in the flood. A person who is visually impaired, and the trainer is throwing the rope to that person. It is useless. or the person is hearing impaired, and one person or trainer is giving just instructions to do this, do that, and like that, it's useless again. So my point is that the trainer must know how to treat the disabled person in the shelters, in the rescue camps, and it may be practicable. Of course, it's difficult, but may be practicable.
In the study that I did in the southern part of the Philippines, you will notice that there's a mix of response. Some elderly are willing to go, but because by default, the local government response agency would not allow them because of age, so they're not given the opportunity. Likewise, there are also children of the elderly who do not like their parents to because they're afraid that something might happen. Okay, so probably I think the way to increase inspiration, self-efficacy is to provide an opportunity for them, and perhaps I think most of the government efforts are not really asking directly from the elderly, would you be willing to be volunteers? Because that's not allowed by law because they are defined to be vulnerable group. So probably the way is to provide a platform for them because by nature, I think a lot of established elder people have wisdom, already proven themselves, and they have nothing more to prove, and they want to pay it forward, pay back as a volunteer. I think there are a lot of that, not only in the Philippines, but elsewhere in this entire world. Thank you.
Thank you very much for your question. In my opinion, I would say when we need to enforce that, we will need to work from the ground level, which is going down to the community and and the very first thing we need to see is to understand the community, the people in the community, what their needs are. When we get to understand their needs, then we can actually derive what strategies will actually work for them. And then they can also validate it by telling their views, if yes, that would work for them or no. So that's how we would actually work towards it. Thank you.
Thank you. And so if you saw the slides earlier, one of the recommendations would be to include them, so include marginalized groups in the planning and decision-making processes so that then they have a voice and that way we will know directly what actually is needed from them directly. Thank you.
Awesome. I think our friend from UNDRR, and then we'll move up this way, if that's okay. And then we'll move over here. It might be best if actually the mic just goes from there to there to there.
Thank you very much, everyone. Kia ora koutou. My name's Branwen Miller. I'm the gender advisor with UNDRR and support some of the disability work also that we're doing. Priti, you mentioned the 2013 global survey on persons with disability in situations of disasters. And I just wanted to provide an update that last year we repeated that survey a decade later. So the 2023 global survey on persons with disabilities in situations of disasters, and about 6,500 people with disabilities answered that survey. I just wanted to comment and ask for your responses to this, because I know we often have a narrative of inclusive governance, nothing about us without us, and all of that narrative. And I think that there's occasionally a danger that pushing that too strongly takes the onus off those of us who do not have a disability to have to do anything about disability inclusion in our work, because we leave that over to the persons with disabilities to lead on their way rather than making that space for them to do it. And one of the interesting findings of the survey last year was actually the priorities identified through that survey were not related to participation strongly. They were related to addressing underlying risk factors like poverty, inequity, access to livelihoods, education, those structural barriers that we see. They were about ensuring universal design principles in DRR actions and what the broader DRR community should be doing. And the community, the respondents to the survey said, of course, participation is important, but it was really low down the list in terms of the priorities that they identified. And obviously, it's not an either or scenario, but how do we get that balance between taking responsibility and being accountable for persons with disabilities or the elderly in terms of the disaster risk reduction work that we do, and providing the space and making sure that they are empowered and have the opportunities and leadership to do the decision making themselves.
No, we'll take the question. You can answer now, and then we can take the question after.
Yeah, I hope I get it right. Well, I agree fully that not all the elderly might be sharing this advocacy. But maybe I'm relying so much on my findings and the earlier findings that I've got from that. This is something that they would like to pursue, at least from the context of the Philippines and the area where I studied elderly. There's no really a clear platform or where they venue where they can exercise this, but I'm not sure if I was able to capture the perspectives of a selective elderly, maybe retired teachers, and maybe retired farmers. I'm not sure, but I didn't bother to check. But more or less, I am banking on the idea that this is something that could be pursued. I agree. It should not be. It should be shared. That's why I think it's important to find out from the elderly themselves, is this something that you want to do? They should be consulted. It should not be a policy that should be imposed to them. But if this is something that they feel worth doing, and this is something that they want to do, and it's available. In fact, I realized that I think elderly would not look for incentive because this is something that they have done. They had gone to the point that they have reached the peak of their life, and what they can do is something for the benefit of many.
If I'm right, you are talking about community responses. Community responses, talking about community responses in India. In the normal situations also, the disabled person is left to die. Now, very slowly, the situations are changing. But still, in the situation of disaster, it is looked that it's a good chance to let the person to die. So this is the community response.
If we may just add, I forgot to mention that in the Philippines, we have a formal organization of elderly, but their focus is not on DRR related. So I think what will make it more the way to concretely pursue about this is make use of that association of elderly people in every parts of the Philippines to how they can be I don't want to use the word empowered because it's being questioned. They will be they will be prepared physically, emotionally, and physically to be part of the disaster response and preparedness. So I think I forgot to mention that, but there's already a mechanism, but this is not focused on DRR. It has nothing to do with DRR, but it's more on them as elderly population of the country.
Thank you, ma'am, for your feedback and the update that you've provided. With those notes, even coming from Pacific Island countries, I would still feel that the way Pacific Island is geographically located, we are not able to access all islands. So there is a need, like when it comes to considering DRR efforts, we need to actually hear from every individual. So we need to reach out to everyone. So I believe in terms of Pacific Island, we have a different structure. We have a different certain level of vulnerability that we need to assess and address. So it could be a bit different in our case. Thank you.
Okay, Anik.
Hello, Anik Maslow from Canterbury. Thank you for this really interesting panel again. So I'm really interested in, well, vulnerabilities, but also in the aging population. So in a lot of country, there is an aging population. So elderly covers a huge period of life, in fact, and you said it starts at 60, but some elderly, in fact, it's way more granulous because some elderly are themselves carer of more elderly. And the same as with children, I think there are like different stage in people's elderly situation. And what I'm hearing from you is, so there is the individual response or the engagement with the individual, and then there is the engagement with the community. But I think we're missing the stage of the engagement with the caregiver, I suppose. This more like familial or maybe like caring relationship. And I'm wondering whether you've come across any of those. And I think it's not just for elderly. I think it does cover all of the situation of vulnerability, but whether there is a middle way also to engage not the vulnerable people or the individuals, but in the unit, in their caring units, and whether you've come across any of those issues. Thank you.
I think that's the reason why I highlighted these are elderlies living in their homes, because the caring institution for the elderly in the Philippines is not much of maybe government efforts, but very few, because by culture we strongly believe that it's our responsibility to take care of our older people. So it would be difficult and emotionally uncomfortable if we see our older people, our parents, living outside of the home. So we don't have yet that concept of putting them in an institution. In fact, we had recent experience of deciding whether they put in an institution, but it was a very a heated debate because this is not part of our culture practice. Thank you.
Thank you. Over to you, Nand. Anybody else had a question? They want to raise their hand, so we just, so we know that the mic needs to travel all the way to the back of the room now.
Right. Kia ora, thank you, panel. I'm going to also stick with the theme of vulnerability. And I just wondered whether what we actually need is more nuance in identifying who is vulnerable, which I think is partly what you're talking about, Marlon. So it's not the case that all old people are vulnerable, and it's not the case that all people with disabilities are vulnerable, right? And but we use these labels to help us make decisions and plans and things, but actually whether we need a little bit more nuance in there. And Marlon, just to share an example from Canterbury, a very similar experience happened with our old people in Christchurch after the earthquakes. So as in your example, old people, vulnerable, sidelined, marginalized, we'll protect them. And eventually a narrative emerged of exactly what you identified, actually the skills and experiences that old people have can contribute to resilience. And then another narrative, similar to what Anik was saying, the young old and the old, right? So I just wanted to share that example, but then I'd be interested in the panel's views on whether actually we're using this label of vulnerability too absolutely. Thank you.
Who'd like to start on the panel? Lots of nodding, but nobody's reaching for the microphone. Or shall we take both questions and then we?
Question follows, I think, quite
Okay, cool.
Yeah. Thank you. I realized, thank you, Marlon, that I am elderly. Thank you. I just wanted to share with the group that in my friend group, we say that we used to be young and beautiful, and now we're just beautiful. The question that I have follows on my colleague's question, and I mean, it's obvious to everybody in the room from the subtlety and sophistication of the work that's being done in this room that identities are so multiple, and there's always a danger of essentializing people into one identity. And so I just wondered from our distinguished panelists, how do you keep, following from my colleague's question, how do you keep from generalizing based on one element of somebody's identity? Thank you.
Yeah,
For those who didn't hear, Priti just said she's looking for some data that she's kindly printed off
She's looking
already.
for her notes. Maybe I, yeah. Yeah. Yeah.
I guess I'm not taken in this paper.
But you have it,
Okay.
if you can remember.
I have some data, but I think I lost it in this paper. In the tsunami, do you know tsunami? I guess in 2011, 76 disabled persons were left to die at the time of tsunami. In the Kerala flood, according to the authentic data, 31 persons were left to die without giving any assistance or without giving any rescue or response. I'm having data, I'll show you afterwards. Not I'm having in this paper just now. So the statement is not generalized. It is based on the research, and it is based on the data provided by the government itself. Yeah.
It may sound funny for us, but I think I like the idea of dividing the elderly into a class, a young, old, middle, old, and old. Maybe that's a way to start, probably, because it will invite discussion. Because yeah, they will. I'm sure Philippine government, for example, will realize there's a good point in because a lot of human resource are wasted because of the definition of the policy. So there's no opportunity because they're not allowed. There's no opportunity because the family members do not allow. But if the government will come up with this kind of mechanism of redefining who are elderly and who could be volunteers in DRR, I think that's a good way to more or less address to start with that, maybe, and I'm sure elderly are very persistent, you know. if they see the value of what they're fighting for, I think, and we have massive, as I was saying, we have a formal organization, and that could be a venue for this. I hope we were able to respond to your question. Thank you.
Maybe just another quick comment to add around how I should also kind of with the caveat that I'm not an expert like the panel sitting over here, but there are also reasons for decisions around classification that are highly politicized, right? So in Fiji, for example, and I really hope I don't get in trouble for saying this, there was a decision around 15 years ago to reduce the retirement age to 55 because there was an employment deficit, but we couldn't hire people that were graduating from university. So the solution, as unfair as it sounds, was to force retirement for people who were only 55 years old to then make way for new employment of teachers and doctors and nurses. So, I mean, this kind of decision is also a really important thing to recognize when we're kind of identifying the reasons for the status quo as it be. Do we have any more questions or comments? Oh. We'll bounce to John first and then back to Natalie. Enough with this politeness. Why don't you take my?
Okay, just briefly. So I back to, I'm sorry, I forgot your name. Brandman, some apology. Brandman's comment, I thought it was a really good comment about participation. I'm an administrative lawyer originally, so very boring. But in administrative law, of course, a lot of the challenges are around lack of consultation. You know, people will say, "Oh, we weren't consulted," but it's nothing to do with that. It doesn't mean that you want to be consulted. You only care if the end result is not what you agree with. So the question, I think, is how do we get policies or the use of discretion, as you said, Ernest, like not necessarily the physical, the formal law, but the discretion that takes into account the needs of, for example, the elderly or disabled people in a way that's meaningful. But we need to get them to participate, otherwise we won't get it. A classic example, I think, is so if you go around on campus, you will find in every building there is a in the stairwell there's a sort of a chair to take somebody who's has mobility issues in the event of a fire. There's one, which always strikes me. So if there's a fire, as I say to my students, pick your favorite. Now that's, you know, so we've ticked the box. We've said, you know, but I think if that had been considered at an earlier stage by people who would know more about it, they would have said, I don't think one chair is the solution to the fact that we're going to, you know, we could risk having people with disabilities stuck at the top of a building in a fire. Anyway,
thanks for that comment of hope, John. It's as hopeful as the lifeboats in the Titanic, right? Natalie,
Kia ora, no, Natalie from University of Canterbury. Actually, I have the word hope in my question. So there we go. My question is for Priti, and it's picking up on Marco's comment this morning about the fact that the Convention on the Rights of Persons with Disabilities, Article 11, is almost unique in having actually a legal obligation in relation to disaster risk. And the committee is currently working on drafting a general comment for states on how to implement Article 11. And so my question was just, what do you hope, there's the hope, what do you hope the committee might include in this? Or do you have any thoughts about the sort of top, you know, 3 things, say, that it would be good for the committee to include in this guideline advice to states about how to implement Article 11? Thank you.
Including in the guidelines, disability. Very first, I previously talked about the trainers. The trainers must be trained for the rescue of the disabled person. As I said earlier, that there are 21 types, and it's very difficult, really it is difficult to include all the 21 types and to train the person for 21 all the types. But few are very, very needed. For example, a person suffering from cerebral palsy or multiple disability person should be included in the guidelines. One another thing I missed, and I take an opportunity to say that the training should be given to the disabled person also for disaster management. In my studies, I got that nearly 96% of my respondents were willing that they must be trained for the disaster management or disaster risk reduction. The tutors particularly were very willing to get the training or get the preparedness for facing the disasters. Awareness among the person itself, herself or himself, should be also created for disaster, in particularly that area, which is, for example, earthquake prone area. In that case, the person should be make aware for earthquake. For example, the area which is snow slide falls and all those things, the person should be make aware for that type of disaster, and also the tutor make aware for that type of the disaster. Okay, yes, and representation in the policy making to the disabled person is very necessary in my views. Collaboration is also necessary, and I talked about that previously. And of course, political support is also very essential, which could be incorporated in the guidelines. Thank you.
Thank you. So on that future-focused, forward-looking note, I would like to thank the panelists once again for your time and energy and effort. Thank you all for listening. Two quick notes. It would be remiss of me, given Marlon's push, to not mention that if you are an elderly person or if you know somebody who is elderly that would like to get involved, you can reach out to your local Red Cross branch and get involved with the volunteering programs that they have there. And secondly, I think I'm allowed to say that afternoon tea is served.